Hello, my name is Dr. Stefan Toka from the Dentalklinik Dr. Toka in Sopron in Hungary. Dear patient, thank you for going to Cavendish Imaging. We have received the CT data for the planning of your situation. We created a three-dimensional plan of implant placement, and I would like to show you in this video what exactly I see and what the solution to the problem is. In this first picture you can see your upper jaw and the lower jaw three-dimensional reconstruction. I would like to talk about the lower jaw first of all, so I will make the upper jaw disappear. Here you can see the teeth that you still have in your mouth. I have marked the teeth which are in a very bad condition with the color red, so you can see that we have to or you have to say goodbye to these teeth. Unfortunately, these four here in the front, you can see if I go a little bit closer and make the bone go see through, then you can see that hardly just the tip of the root of those teeth are still inside the bone, and that's why I guess probably they're even moving. I cannot see that on the CT. If the teeth are moving, I would have to check that when you are here. But I wouldn't recommend doing any crowns or anything similar to that on these teeth. I would recommend that we remove these teeth and look for a new solution to close this gap. There's also one tooth here in the back. This is your right side, so the tooth which is very in the back, it also has lost a lot of bone which keeps the tooth in its place. This illness is called periodontitis. It's caused by a chronic inflammation of the gum and the bone around the root of the tooth. Unfortunately, this disease makes teeth that are still in a good condition, so that means maybe they don't even have a single cavity, but they get loose because the bone which holds the tooth inside your mouth disappears. It dissolves because of the chronic inflammation, and the teeth start to get loose, and they might even fall out by themselves. So my recommendation is that we remove these teeth that I have marked here in the color red. So we have still 5 teeth left here inside your mouth. In order to find a solution which does not include a removable denture, so that you have fixed teeth inside your mouth, which is the most comfortable way, I would recommend that we put a bridge on these, or we put crowns on these remaining teeth, and we can build a bridge so we can close this gap. Yeah, just to simulate it, these teeth, which will be replacing the teeth which we have pulled out, will be held by the teeth before and after the gap, so to the right and the left side. Okay, this will be all in one piece, so you can chew again, and aesthetically it's a very, very convenient solution. Now let's talk about the back. This area on your left and on the right side, obviously when you have food inside your mouth, this is the area where you are supposed to chew. So we have to replace these teeth as well. Unfortunately, we cannot create a bridge like here in the front, because we would need another tooth in the back here. But since this is an end situation, okay, there is no more teeth towards the back, I would recommend that we place implants. I'm going to make the bone see-through, and here you can see the implants. Forget about the implants here at the top, I will talk about them later. What we're concentrating now on are these implants here in the lower jaw. Implants are small titanium screws that are placed inside your bone. Okay, we drill a very little hole in local anesthesia, and we place the implant. After the implant has been placed, we have to wait a couple of months. In the lower jaw, it's something between 2 to 4 months, so the screw can heal inside your bone. It gets completely integrated into your bone. That means that once we place the implant and wait for a couple of months, the bone closes the gap between the implant and the bone itself, and you cannot remove this screw anymore. So it's not like a screw in the wall, which you can put in and take out again. This here gets completely integrated into your bone, and it will not fall out anymore, and you cannot unscrew it. And then after this has healed in, we can place crowns, just like here, on top of these implants. So we can replace the teeth which you have lost, I guess, a little bit longer time ago. And the same on your left side, but you have a bit more teeth here, so we will only need one implant in this situation, so that one implant can hold one tooth. There's one important anatomical structure in your mandible, in the lower jaw. This is a nerve which is responsible for touch sensation of your lip. So when I place an implant in this so-called molar region, which is the back teeth, I have to calculate the distance from the surface of your tooth to the beginning of the nerve, okay? And I have more than enough bone in your case, so we do not need any bone augmentation. We do not replace, we do not have to replace bone that might have been lost. We can just place the implant. Very simple situation. We do not even have to open the gum. We will just place the implant through the gum, so you won't even have any bleeding injury. Okay, the same obviously counts for the other side as well. So much about the lower part. This is a very, very good solution. Also, financially, I would recommend that we stick to this option. On your plan, on your quotation, you will see, and Catalan can also describe you, that you can choose from two kinds of materials. One is the titanium crown. Yeah, it's a titanium fused with porcelain, or the other one is a zirconium fused with porcelain. The only difference is in the aesthetics. The inner side of the titanium fused to porcelain is a metal. Yeah, titanium is gray, and the outside of the crown will be covered with porcelain, so it looks like your own teeth. The other, the zirconium crown, does not have a titanium base, so it's not gray, but it is white. Zirconium is white. And we have a white background, which is then again fused to porcelain. The zirconium teeth are a little bit lighter, okay? They might look a bit more like your own teeth. But if you have a smile line, which unfortunately I cannot tell right now, and this is also something you only have to decide after the implants have been placed and we waited for the healing time. So we're talking about things that will happen a lot of months after we place the implants. So you can decide if either you want the zirconium crowns, which are a little bit lighter, or the titanium crowns. But once you are here, we can discuss this personally again. Okay. So much about the lower teeth. I will make the lower jaw disappear now. Just give me a moment. And we will talk about the upper jaw now. As you can see, it's a different situation. You can see that I have marked all your teeth in the upper jaw with the color red. Unfortunately, all your teeth are in a very bad shape. You have lost a lot of bone, and I'm pretty sure that some of these teeth, especially this one here in the front, are loose already. They hardly have any contact to the bone anymore. That's why putting a bridge or a crown, just like in the lower jaw, would not be a recommendation. I do not recommend that because you would invest in a bad foundation. It might happen that in a couple of years, maybe in 5 years, these teeth fall out, and you invested in expensive crowns, and you just have to start over again. So if you decide now to go all the way and restore your mouth, your dental situation, I would recommend that we will have a little surgery in which we remove all the teeth you have left here, and once we have removed all the teeth, we can place 6 implants. Okay, you still have quite good bone left, so there is no problem in placing all the implants. We will have 3 on your right side and 3 on your left side. One thing that I have to talk to you about is that you have, everybody has in his upper jaw a sinus. Yeah, you can see this here. It is right above the mouth. It is a cave basically filled with air, and when we want to place implants in the back here, we have to choose a certain length. Okay, these implants have to be at least 10 millimeters. So when I place this implant here in the back, I can see that the tip of the implant will reach the sinus. In that case, I have to do a little bit of bone augmentation. I have to put a little bit of artificial bone inside your sinus, okay, so it can cover the tip of your implant. It is a very minor operation. I would do it in the same operation when we remove your teeth, place the implants, and also do the bone augmentation. Here you can see the implant has been placed, and this little thing here, so we're talking about like 2 to 3 millimeters, so it's a very, very small amount. It just looks big on the screen. we have to put bone augmentation material to the place where the tip of the implant will come to rest around your sinus. Okay? So this also is on your quotation, and once you come to visit us, we can obviously go through it all again, and we can also start the operation in case you wish that. Now, what kind of teeth have I planned on in the upper jaw? It will be a different situation than in the lower jaw. We have a very special so-called fixed removable denture. That means that it's a certain kind of denture that you can take out, but only by activating a lock. That means that once the denture is inside your mouth and the lock is closed, it cannot fall out. Okay, so it's completely fixed inside your mouth. There's no way it can fall out. You will get little I will explain in the short video. You will get a little key, this one here, this golden key from us, with which you can remove the denture. Let's watch this video now. As you can see in this model, they have been implants placed. Okay, this is the position of the implant. This is just in this example. This is a lower jaw, but we were talking in your case about the upper jaw. Here, 4 implants have been placed. In your case, we would need 6 implants because the upper jaw is a lot softer than the lower jaw, so we need a little bit more implants. We placed 6 implants, and on top of these implants, after we waited approximately 4 to 6 months, you will get a titanium bar, which is screwed and fixed on top of the implant. And this titanium bar includes the locks, which you can see here. If you follow the cursor, you can see these little holes here on this side and on the other side as well. Okay, so these are the locks I am talking about. In a moment, you will see how the denture finally looks like. This is the denture you will get. Okay, this little thing here is the hole where the key is put in, and this is how the denture looks like. So you have perfect, beautiful teeth. You can even choose the color and shape just as you like to. And because you have lost some of the bone and the gum already because of the periodontitis, here you can see with this pink color we can even replace the gum that has been lost. So we do not have to create very long teeth, but we can create artificial gum as well. What I'm showing here right now in this video is that even with this little pin, you can open the lock on both sides of the denture. You can see it pops right towards the inside, and then you can remove it. I will stop the video right here now. So just to repeat, this is the titanium bar, which is fixed on the implant inside your mouth. This here is the fixed removable denture. Okay, once the locks have been closed, it will not fall out. So it's like fixed teeth. There's just no way it can fall out. But you have these little keys or any other material you can use. You just put them in this little hole on the side, which I will show in a moment again. And once the locks are open, you can take the denture out. For hygienic reasons, this is a very, very good situation because you can keep the bar inside your mouth very easily cleaned with a toothbrush, but you can take out the other part and clean inside your hand. So it's very, very easy to clean. Here I'm showing how you close the lock. You see, I just used my finger, I pushed in the pin again, and the lock is closed. Once I use, for example, just this little pin, I can open the lock again. Okay, this is how the mechanics work. Then I put in the overdenture on the titanium bar, use my finger to push this button on the inside, and the lock is closed. Okay, when you push it in properly, you cannot even feel it with your tongue. So this is absolutely fixed to the titanium bar or the implant, and it will not fall out. It is a much better solution than a removable denture, because a removable denture has a part which goes has a palatal part, so it goes over the inside of your palatinum, yeah, this upper part in your upper jaw. But this here is only shaped like a U. Okay, so it's a lot smaller than a removable denture, and also when you chew on it, the force is only pushed on the implants and will not be pushed on the gum, so it is a lot more comfortable to wear. Also, in case anything happens and you bite on something and a little piece breaks off, it is very, very easy to repair. Even any dentist in the UK can repair it. Okay, much better than porcelain teeth. They are very, very hard to repair. Okay. So much to your treatment plan. If you have any questions, please just call Catalin or write us an email, and I can tell you anything you would like to hear. Thank you very much for your